Hello, good evening. Myself, Dr. Sajit Khan. I'm a specialist in microbiology at Micro Health Laboratories. Today, I'm going to brief about a very important emerging pathogen, particularly causing the respiratory tract illnesses, which is the human metapneumovirus. Otherwise, in short, we can call it as HMPV. This virus is very ubiquitous in nature. It's a potential respiratory pathogen. This pathogen was first detected in the year 2001. It mainly affects in the winters and in spring seasons. Mainly, it causes infections in children, in the elderly adults, and also in immunocompromised individuals. This virus can cause many types of respiratory illness, ranging from mild upper respiratory tract infections to severe lower respiratory tract infections. The mode of transmission is mainly through inhalation through the respiratory droplets, where it has an affinity to the respiratory epithelial cells. The virion, the viral genome, is a single stranded negative sense RNA genome. It's an enveloped virus. It belongs to the family Paramyxoviridae. This virus, it consists of two serotypes, and it has at least four viral lineages. And these lineages can be seen everywhere. And these lineages, they are all important because multiple lineages can also be seen at a particular geographical location at the same time. Coming to the clinical symptoms, the symptoms produced by human metapneumovirus and the RSV, respiratory syncytial virus, cannot be indistinguishable because it's almost the same. And I already told that it mainly affects the children. So in children, the symptoms starts with rhinorrhea, sore throat, fever, cough, and sometimes it can lead to acute otitis media. It can also lead to lower respiratory tract infections like bronchiolitis, pneumonia. It can lead to croup and exacerbation of asthma. It can lead to complications like secondary bacterial infections, acute respiratory tract infections, and ARDS syndromes. So this in normal healthy adults also it can lead to common cold or flu-like symptoms because of the involvement of this virus. It apart from children, it can cause infections in the elderly adults and also in immunocompromised individuals. Usually, this virus is asymptomatic, and it is asymptomatic all the time when compared to the influenza virus and the respiratory syncytial virus. Coming to the diagnostic aspect, the ideal specimen will be the nasopharyngeal aspirates or the nasal swab. And diagnosis is mainly by molecular methods using the RT-PCR. So the viral RNA genome can be detected by using this RT-PCR, which is the gold standard method. The antigen detection is mainly done from the respiratory specimens by direct immunofluorescence testing. But it is sensitive only in children, but not sensitive in adults. And serological detection for detecting the antibodies in paired sera, it is only for research purpose and not much into diagnostic area. Coming to the treatment aspect, there is no specific treatment, no specific antivirals available for this HMPV infection. And there is no vaccines are available for prevention. Vaccine, lot of research being carried out to bring in the vaccine by which we can prevent this condition. So general measures has to be taken like proper hand washing, spacing, and any contact with the infected person has to be minimized, and also use of personal protective equipments is very important. So this virus now it's a global concern, and whenever people experience a common cold or flu-like symptoms, or there are symptoms of bronchiolitis or pneumonia, or when the common pathogens cannot be diagnosed by using molecular approach, we should always think about the possibility of human metapneumovirus infection. So, though it's an emerging respiratory pathogen, common public should not be panic of this condition because it can be very much preventable. Though we don't have specific treatment or vaccines, still we can able to prevent by general measures. Infection control practices is very important, like wearing a face mask, spacing distance from the infected persons, and having the personal protective equipments, and not to touch the surfaces where there is a possibility of transmission of infections, and never go in close contact with the infected person. So all these measures can we can follow to prevent these type of infections. Thank you.